Large audience this afternoon. These are the die-hard fans who have decided to stay to the bitter end. So thank you very much for joining us this afternoon. Let me just ask if people could take your seats and we'll get started. And is there someone in the audience who might be able to help with the audio-visual? Just I'd rather look at my slides instead of myself on the screen. Okay, thank you. Thank you. So I would like to start our last session, first of all, by really, again, thanking Maitri and thanking the Oak Foundation for making this possible. I think particularly on the eve of the International Women's Day, it is fitting and appropriate that we come together to exchange ideas, to share research, and to talk about the way forward in addressing the issue of violence against women. Last night, when I was trying to finish my presentation, my 10-year-old son came over and wanted to kick me off the computer. And he started to look at my slides. And I said to him, "Oh, this is not for you." And later I thought about it, and I thought, yes, this is for you. As we think about celebrating International Women's Day tomorrow, those of us who work in the field of violence have a wish, and that is that our daughters and sons, our granddaughters, our grandsons, maybe our great-granddaughters and great-grandsons will live in a world without gender violence. And so for our last panel discussion today, I'd like to shift the focus a bit to really think about prevention. What can we do to reduce the occurrence of violence? And importantly, what does the research tell us globally about the risk factors for violence? And then what do we know so far about the effectiveness of various strategies for intervention? I am a public health specialist. By training, I'm a reproductive health specialist and have spent about 20 years working both on the program side and the research side on reproductive health and gender violence issues. I have a very challenging task this afternoon. I've been asked to present and to chair, so I will try to speak very rapidly to give my esteemed colleagues time as well to present what I'm sure you will find are very interesting findings from their research and practical experience. So very quickly, in the next 10 minutes, I'm going to introduce you, or perhaps review for some of you, the public health approach to preventing violence. It's a framework for thinking about violence. And then I would like to very quickly summarize what do the trends in the global research tell us about the risk factors for the occurrence of violence, and what are the effective strategies for intervention. I am going to really focus on intimate partner violence. We've heard about a full range of violence, different acts and behaviors. That is not to minimize the importance of those forms of violence, but the reality is that worldwide, intimate partner violence is the most common form of violence experienced by women. And it is predominantly carried out by men. And so in the field of public health, what we really want to look at is how we can help the maximum number of people. And so for that reason, today I will focus on the research related to intimate partner violence. Now, the public health approach, we are really concerned with the health of populations. Of course, we're concerned about individual women, but we really look at the occurrence of violence in a population? Why is it that violence is more prevalent in some communities and less in others? Why in some states is it high, in other places it's lower? And our overall goal is, over the long term, to reduce the occurrence of violence. In public health, there is also a wide recognition that violence is a multifaceted problem. And one of our speakers is going to talk in depth about that there is no single causal factor, that violence occurs due to a whole range of risk factors that we are just now really beginning to understand. So there are risk factors for perpetrating violence, and there are risk factors for becoming a victim of violence. And the more we understand about that, the more we will be able to intervene to eliminate or reduce those risk factors and hopefully reduce the risk that violence occurs. And finally, public health is a field that we say is evidence-driven. And what that means is that we try to conduct studies, research to get hard evidence that helps us understand the causal factors and then evaluate the effectiveness of a variety of strategies to intervene. So just very quickly, this gives you a visual that we know from research that there are a whole host of risk factors that increase the chance that a man will perpetrate violence. And there are also a whole host of risk factors that increase the chance that a woman will be a victim of violence. So we have two different types of risk factors, and the challenge for those of us in the public health field, and also for many of you working in other fields, is thinking about how can we address those risks so that we will meet our eventual goal, which is to reduce violence. Now, in public health, we have developed a model that tries to, again, emphasize that there is no single cause of violence. There is an interplay of all different types of factors at the individual level. These are the personality characteristics or the life experiences of both men and women that can determine whether violence occurs. There are relationship level factors. And you've heard from some of the speakers this morning and this afternoon about some of the dynamics in a relationship that may increase the likelihood of perpetrating or experiencing violence. Then in the community level, this is a newer area of research, but one that is being recognized as very important, and that is the influence of peers, of community norms and attitudes about violence. Are there factors in a community that result in high levels of violence in one community, but lower levels in another? And what can we understand about that? And then at the societal level as well. I'll very quickly, in the interest of time, try to summarize from the global literature what we know. And I would like to say that in the early days, much of the research that it was done on violence was done in high-income countries. And this is rapidly changing for the better. And what you see in the last 5 to 7 years is a lot of research now coming from low and middle income countries that are really contributing to a global understanding of violence. And a lot of this research is coming out of India. So the experiences, the results, and as well as trying to learn from the strategies that are being implemented here in India has relevance not just for the Indian context, but for all of those people who are working in the field of violence around the world. So what you will see in this slide, and I'm not going to go through every one of these, but you will see that much of the research that has been done trying to understand risk factors for violence has been done at the individual level. What are the characteristics of men? that increase the likelihood they will perpetrate violence, and what are the individual characteristics of women that increase the chance that she'll become a victim. And these factors that have a red check mark by them, those are factors where we have a significant body of evidence from countries around the world. India has contributed to many of these studies that show that, yes, we can say with a great level of certainty that those factors make a difference. And I'll just take one or two to illustrate the point. We talked this morning, one of the speakers was talking about the importance of childhood maltreatment. So we know very clearly from the research now that particularly for women, if you have been victimized, sexual abuse, or you've witnessed domestic violence with your parents as a child, for girl children, this will elevate your risk for later in life becoming a victim of domestic violence. Now for men, the evidence is a little bit mixed. What we see is if as a boy you have been a victim of sexual abuse, you will have an increased chance of perpetrating violence yourself. The evidence is mixed in terms of boys' exposure to parental violence. The other one I guess I'll touch on, because we did hear this from a panel discussion earlier in the morning, is the role of alcohol. And it is quite clear now, not that alcohol is a cause, but that alcohol is a trigger, particularly for perpetrators. And this holds true across communities, across cultures, across countries. Very quickly, you'll see that there is less evidence available, less research that's been done at the relationship level. This doesn't mean that that's not important. It means that we know less about the dynamics in a relationship and how that may affect violent outcomes. Community level, I mentioned that this is really a new and growing field of research, and it's very important because what we are beginning to see is that there may be characteristics of a community, poverty, high unemployment, social norms that accept violence, or social norms among peers that people feel it is okay to use physical discipline against a woman, that context makes a difference when we look at the likelihood of perpetration or victimization. And finally, at the societal level, there is some very interesting emerging evidence coming out showing that particularly for women, the existence of a legal framework that provides protections both in marriage, access for divorce, as well as protection for domestic violence, that this can all help reduce levels of violence in the community. So what are the implications for prevention and strategies for addressing this then? Many of our speakers earlier in the day have touched on these, and I just want to highlight them because what we are seeing is globally that there is evidence to say that these strategies have the potential for effectively reducing violence. One very important finding that has implications for the interventions is the importance of engaging men. And I think we've heard that a number of times today, and I can't emphasize it enough. This is really critical. This issue cannot be addressed by working with women alone. We need to work with men and boys. Second is that there's really a lot of work that needs to be done to reduce and prevent child maltreatment, including physical and sexual abuse. A lot of the research that's been done on this has been done in higher income countries, and some promising results for home-based visits and school-based programs. We have heard from a number of speakers about the importance of addressing gender equity. This means equal opportunities for education, for employment for women, but also recognizing that these changes in gender roles can often result in a short-term backlash where you may actually see a spike in violence. And finally, reducing access to alcohol or harmful alcohol use has been shown to be a very effective strategy at the community level. So thinking about where alcohol is sold, treatment that is available for people who have an alcohol problem, this can have a tremendous effect on reducing violence. And finally, one of the very interesting and difficult areas is really thinking about how do we change social norms? How do we create in our own communities, in our families and communities, a climate for non-tolerance of violence? We heard from Breakthrough earlier about their work trying to use social media and community mobilization to begin to get people to think in a different way about gender roles and the use of violence. So with that quick overview, I am going to switch roles now from presenter to the chair, and it's my pleasure to begin to introduce a very distinguished panel this afternoon who will talk to you about various research and practical experience that they have had working on the issue of violence. Thank you. I'm coming back. All right, our first panel speaker today is going to be Dr. Ritu Mahendru. And she has a doctorate in sociology from the University of Kent and a master's of science in public health. She has written a book called On Gender Risk and AIDS, and she divides her time between India and the UK. She runs the South Asian Sexual Health Forum for the diaspora community, and she is also a board member of South Hall Black Sisters. And she is going to talk to us about the intersectionality of domestic violence.
Thank you for the introduction, Ariel. Okay, before I start talking about intersectionality, what I want to say is that intersectionality, I only got introduced to the concept of intersectionality only 2 years ago when I was finishing my PhD. And I found it a very difficult and very complex concept to understand. And when I was informed about this conference, I felt, and I was invited to speak, today, I kept wondering, what should I present? What can I present in Indian context? And I felt, I looked at sexual identity and gender identity of British Indians living in the UK. And I felt, how could I make it relevant, in an Indian context? So I found it very difficult to, then I thought, okay, I could present a theoretical paper. I could get some data from somewhere and, explain people what intersectionality is. But when I started looking around, started speaking to people across India, I found there's no data on intersectionality. A lot of data actually was very much limited to, economic status of women, was very limited to class issues, very limited to urban-rural areas, and traditional modern dichotomous relationships. So today I'm going to discuss the importance of intersectionality, and which I feel can be both useful and fruitful in reconceptualizing domestic violence in Indian context. And I'll be speaking from feminist research standpoints by highlighting gaps in the knowledge around domestic violence in India. And these gaps that I'm going to highlight is basically based on anecdotal data that I collected, after speaking to experts across India who are experts who are working in domestic violence across India. So obviously, people argue that if you don't have data, how can you present what you're presenting? I don't have data. I agree with that. It's an anecdotal data. But I feel sometimes your observations, your anecdotal data, theories that have been tested in other countries can be useful method of collecting data, of initiating new ways of researching issues in different countries. So that's what I'm going to talk about. And like I said, intersectionality is a very complex theory. So I'll try to be as simplistic as I can, simple, not simplistic, as I can. Try to be uncomplicated, even though intersectionality is a complex theory in itself. So today I'm going to cover what we know currently in terms on domestic violence in India, what intersectionality is, and then I'm going to touch upon concepts in intersectionality and also interplay of social hierarchies and social exclusion. These two concepts are very much related to intersectionality. Then I'm going to talk about case of Kiranjit Ahluwalia. We'll get to that later, and then I'm going to conclude my presentation. So, like I said to you earlier, when I started, looking at data in Indian context, I found that the data is very much limited to urban, rural, employed, unemployed, and traditional modern analysis. I felt that a lot of women's lives are being defined quantitatively. Many women, many communities are being excluded, from the research that is being carried out in Indian context. So, what is intersectionality? Intersectionality is a term coined by a black feminist, Kimberly Crenshaw, in 1989, whereby she showed the relationship between social and cultural categories that cut across and produce inequalities in women's lives. Intersectionality implies more than gender research. It is not only limited to gender, but it's not only limited to the diversities between and within women's and men's groups. It's more than that. To me, intersectionality is a theory and methodology of studying female diversity and marginality and how they intersect and produce knowledge of marginalization. Intersectionality is the relationships among multiple dimensions and modalities of social relationships and subject formation. It moves away from the whole concept of triple oppression. If you have heard of that theory, Brian et al. In 1985, they introduced a theory saying that, to understand female realities, we need to look at triple oppression. We need to look at gender, we need to look at class, and we need to look at race. And intersectionality argues that we need to move away from that concept. We need to look at other intersecting factors that actually defines women's status in the society that end up producing structural inequalities. So the two concepts that I felt are really important for me to discuss today, one of them is positionality. So intersectionality speaks from women's different positions in the society based on the class, caste, ability, geographical location, etc. So if you look at data from India, I don't know how many researches have been conducted that have taken women's position in women's position in the society to conduct a research. For example, whether she is migrant, is she disabled, is she from a certain class? So these are intersecting factors that defines her status in the society and obviously end up producing inequalities. And I'll explain more on that graphically. So what I'm going to do is I'm going to show you the interplay of social hierarchies here. So what I'm saying is, so what happens if a woman is migrant? What happens if she's disabled? What happens if she's have a different skin colors? And we know how this hierarchy works in Indian context. If you're dark skinned, then how people react to that. And in certain cases, I have noticed, like I said, from anecdotal data and after speaking to people, that if a woman is dark and her husband is beating her, you start saying, oh, bichara guy, poor guy, it's not his fault. What can he do? He's got bad luck. He's got a dark wife. So that can prevent people from accessing information because they're being socially excluded. So people from certain class, what happens when somebody is migrant, somebody is disabled, somebody has a different skin color, which is not acceptable in our Indian society, and somebody from a low class. And obviously, gender itself is a marginalized position. And what happens if somebody is Dalit? So when all these different intersections, when all these different intersections meet, then what happens? It produces structural inequalities. And what intersectionality argues is that all these different intersections meet at the same time. One intersection doesn't take priority over the other. So I can't say, oh, because she's Dalit, that's why she's facing more domestic violence than others. We say, because she's Dalit, because she's migrant, because she's woman, and because she doesn't know the language, that's why incidence of domestic violence in certain areas is higher than the other. So we need to take all these intersectional ways of defining women's status, and these different. So what happens is, imagine you have a house. When you go to your house, what do? You either drive, or you either walk, or you take a bus, or you take a tube. Now, when you're taking a tube, a metro, for example, then you go from one station to another station. You get to the street. You walk out of the station. You walk to your house. While you're walking, you're crossing different streets at the same time. Right? So those different streets defines your path, and then you come to your house. Now that is your position. So similarly, intersectionality, you have different intersections, different paths that you take in your life, or different paths, different statuses that are defined by society, and people identify you based on those statuses, and then you create an identity for yourself. So your house is an identity for you. So similarly, for a woman, these are different paths, different routes she's taken if she's a migrant, and that creates an unequal status for her in the society. So, what intersectionality argues is that we need to understand women's marginalization, obviously, but we also need to take diverse experiences in the society. For example, how do you produce knowledge of marginalization? That's what intersectionality is all about. That's what domestic violence is all about. How do you produce knowledge of marginalization? You produce knowledge of marginalization by constructing and reconstructing definition of domestic violence. And it also says that we not only need to look at people from certain class or certain location, we need to have diverse experiences. When we talk about I've heard people talking about domestic violence all day today, but I was quite surprised that none of us have been, we've been generalizing domestic violence across classes, across caste, and we are forgetting the importance of, vitality of different backgrounds people come from. So intersectionality focuses on that diversity. So what it says, it focuses on the needs of minority. So can we say that Dalit communities are minority? Can we say disabled women are minority in the country? So it focuses on the needs of the minority who have troublesome identities. Now, by troublesome, I mean who do not fit in the so-called normalized lifestyles or behaviors, for example, Dalit women and less able women. It argues that identities are multidimensional and spatially bound. So I am not just a woman, I am a migrant. I live in the UK, so I have that migrant identity. So we need to look at different identities that women carry with themselves and make knowledge and create knowledge based on that positionality. While it focuses on diversity, it also says that we need to look at individual experiences. For example, every woman has her own story. We need to listen to those marginalized stories. We need to understand where they're coming from. Now, you can argue that how can we record individual stories when we're researching so many hundreds and thousands of women? Yes, this is a difficult task. But what you can do is you can draw common patterns, from that, data and try to present lives in intersectional ways. Now, connected to the concept of intersectionality is concept of power. The concept of power is used as a process of social exclusion and inclusion, and how power functions in a society. So, for example, certain communities in our society are powerful, and certain communities are powerless because of such structural inequalities. So like Ariel mentioned, that we need to look at the powerful and we need to look at the powerless as well to create knowledge, to understand what's going on. So we don't really need to know what's happening in victims' life. We also need to know what the perpetrator is doing, where are they coming from. We need to look at their background as well. We need to look at their intersectional background as well. And what can happen then is, what I'm going to do now is, so what happens when you're socially included or excluded from a society? People often get socially excluded from the society based on their location, based on where they come from, and based on the history. So even though you're a Dalit woman or you're a disabled woman, even though you're rich, you still have that stigma attached to belonging to a certain caste or being a Dalit woman. Right? So what I'm going to do is, I'm going to give you an example of, this is obviously, I'm trying my artistic skills here, it didn't work really well, but I'm going to try. So in this map, we all know that in India, many communities due to caste and class issues often get and feel socially excluded based on where they come from, especially if you're migrant. We have examples of urban-rural analysis that clearly demonstrates how belonging to a geographical location can increase incidence of domestic violence. Now, if you look at this metro map, if you go to Nangaloy, if you compare Nangaloy to Green Park, is it right for me to say that incidence of domestic violence would be more in Nangaloy than it would be in Green Park? That's something we need to think about. And if you take an example of this socially deprived area, Nangaloy, we can hypothesize that women in Nangaloy are more vulnerable than women in Green Park for several reasons. Economic instability, of course, but also other issues that could add into our understanding. Migration that itself can produce social exclusion, but also issue of space. Women living in these areas often have houses with restricted spaces that could cause tension in the family, eventually leading to domestic violence. It is likely that incidents would be higher in Nangaloy, of course, but also violence is spatially bound. So the concept of space is very, very important here, geographical location and space. For example, you would see that violence in places like Nangaloy taking place would take place in public places, and it would be seen as an acceptable and/or cultural. But underlying issue of acceptance comes from excluding a community. When somebody migrates to, like Joe earlier in his presentation said, there are more women migrants than men migrants in India. They migrate because they have marriages. They marry their husband, they move there. So if you're coming from places like UP and Bihar, who do not speak the local language, even if you do, you speak it with a different accent, which has its own stigma attached to it, what happens then? People create their own colonies, and now this is how migrant colonies get created in a city like Delhi. If you belong to that colony, and that is the only sense of your social support, you move from that space to another space. For example, Green Park, you go there. You could go there for any reason. You go there to work, for example. And if you go to their work, which your Dalit identity becomes more dominant than your gender identity, because you'll be worried about people stereotyping you, you'll be worried about getting represented and your representation. So we need to look at all these intersectional issues to define women's status in the society. So what I'm going to do is I'm going to give you a case of Kiranjit Ahluwalia. Have you seen movie Provoked? Yeah? So what happened when Kiranjit Ahluwalia moved to the UK? She moved to a colony formed by Indians for various reasons, racism and all that, which is justifiable. And what happened was if people who don't know Kiranjit Ahluwalia, she's an Indian woman who came to international attention after burning her husband to death in 1989 in response to 10 years of physical, psychological, and social abuse, after initially being convicted of murder and sentenced to life in prison. Ahluwalia's conviction was later overturned on grounds of inadequate counsel and replaced with manslaughter. You look at the case of Kiranjit Ahluwalia. When she moved here, obviously she's a woman that puts her in marginalized position. She's a migrant. She couldn't speak the language. Her class itself, because she's from a rural area, and geographical location within London, added towards her vulnerability. And she felt socially excluded. She didn't know where to seek support. Yes, Southall Black Sisters were there at the time, but they couldn't reach her. We didn't know how to get to her. So we didn't know how to get to her because we didn't have the funding. Because people don't think it's an important issue. Like Joe said, we don't have data, it's not a problem. So after that, obviously things change and things are much better. So this is an example of intersectional dynamics. How intersectionality plays in women's life, the intersectional status of women's lives that put her in marginalized position, eventually creating inequalities, eventually making making life difficult for her, and also making access difficult for her. So, for example, if you look at today, I don't know how many disabled women are here, how many people are representing Dalit communities, how many people are representing disabled women, how many women or men are representing women from different backgrounds. And we need to include these people from these different backgrounds to make sense of what's happening in women's lives in domestic violence. So I'm just going to conclude my presentation. What I think is we need to move away from urban, rural, and traditional modern dichotomies. We need to adopt model of intersectionality that to conceptualize women's lives in the way I presented and constructed in my presentation. People need to tell their interesting stories, intersecting stories of marginalization that shape their multidimensional identities and positionalities that determines their status in the society. We need feminist voices. They could be men or they could be women, but also women from diverse backgrounds. Thank you very much. Thanks.